My name is Moshe Freund, Director of Business Development for BRH Medical. Today, we are excited to announce that BRH Medical has managed to successfully unlock the full power of therapeutic ultrasound since it was first introduced over 60 years ago. This development means first breakthrough for patients suffering from chronic pain and symptoms such as carpal tunnel, diabetic neuropathy, and chronic ulcers. Everybody is familiar with therapeutic ultrasound because it has been used in medicine for over 60 years. However, most people probably do not realize the ultrasound reality. It loses its effectiveness just a few minutes into a treatment session. What causes this is the way the body responds to the ultrasonic waves. After those first few minutes, the body builds impedance, which becomes a barrier that blocks the ultrasound waves and prevents their benefits. ActiVessel is the first and only treatment technology that solves the penetration problem. Ultrasound is the therapeutic component used by ActiVessel. The only difference is that ActiVessel is actually effective. The ActiVessel technician places 4 electrodes around the treatment area before starting the treatment session. The electrodes create an electrical field in the treatment area that counteract the body's impedance. The electrical field keeps the gateways open, allowing for full penetration and effectiveness of the ultrasound therapy. There are many devices in the market that use such combination of electric field stimulation together with ultrasound. However, they only do this to gain double impact by using 2 modalities, and they remain with the fundamental issue of body impedance.
We've decided here to mimic how the BRH ultrasound acts upon a vessel that contains pathological blood or lymph. First, we take a 1 mm tube to represent an artery, vein, and fill it with liquid soap, a thick and congealing substance that mimics the viscosity of pathological blood or lymph. We then place the tube inside a container of water that represents the body. We begin to work with the BRH ultrasound transducer, applying it through the water from all sides of the tube. As the steady pulse of the US reaches the tube's contents, a whirlpool action begins to stir the blood, and there is an increase in velocity, and the viscous substance starts to break down and become more fluid. What was once a heavy congealed substance has lightened up and spreads to fill the entire tube, and the velocity slowly increases to normal healthy levels. All of this has taken place at a depth of up to 10 centimeters, the level of penetration the BRH is able to achieve within the human body.
To date, we have treated hundreds of people, about 15,000 treatments worldwide. We have treated diabetic ulcer, carpal tunnel, cubital tunnel, and diabetic neuropathy with astonishing results. This is what makes ActiVessel such a great solution. It treats people totally non-invasive, painless, and in a relatively short period of time. ActiVessel was developed by our chief scientist, Ilan Pfefferberg. Ilan is a veteran and a prize winner of the prestigious Israeli intelligence unit 8200. This unit is known to be kind of an incubator for cutting-edge Israeli technologies. We feel very privileged to be able to treat people that have no alternative without surgery, without opioids, and get them back to their lives.